Hi everybody, how are you doing? I hope things are going well and your studies are going smoothly. It's time for some biopsychology revision, and today we're going to look at lateralisation and split brain research. As usual, here are some exam style questions. I would encourage you, if you're able to set yourself some time aside. I've put the timings on the screen there for you now as well. Give this a go. Even if you just do it verbally to start with, or if you're ready and you do have the time and space, use those timings, start with a blank page, do try to recall this. Yeah, give it a go, pause the video, come back when you're ready, and I'll talk through. Okay, right, let's go. So, command word, explain. Here, we're not really talking about research in this first one, we're talking about what split brain patients are. So, these are people that have undergone surgery, usually for epilepsy, to separate the two hemispheres. So if you just talk about separating the two hemispheres, or kind of having these two halves working separately, that'll get you a mark. For 2 marks, personally I'd expect to see reference to cutting the corpus callosum. Okay, explain the term hemispheric lateralisation. So straightforward, kind of for 1 mark, this is the idea that the two halves or the two hemispheres of the brain have different functions or are specialised for different things. And I would say, just to be safe, give an example. So the left, for example, is specialised for language. Okay, here we need to, in this third one, talk about research. I'll draw your attention to the word how. So here we need to talk about the procedure of split brain research. The one that you're probably aware of is the study by Sperry and Gazzaniga. So the procedure was they recruited split brain patients, they had them stare at a cross on a screen and flashed images or words to the left or the right visual field. It's not the left or right eye, it's the left or right visual field. And then they asked the participants what they had seen, so they had to report that verbally. Okay, we're not going to go any further than that because it's not about the findings. You could elaborate if you wished, or you could instead talk about the studies where they have asked participants to kind of feel behind the screen and select the object that represents the word or the picture that they'd seen. And they've also done it with simple kind of calculations that they would flash up on the screen, and participants had to again feel for a number. They kind of had I think it was metal, kind of, cutouts of numbers, and they had to feel for the answer. But as I said, the original study that you're probably aware of is the one where they just had to verbally report what they'd seen. Okay, 6 marks, outline research into lateralisation. Well, lateralisation in this context basically means you should be thinking about split brain research. So for 6 marks, it just says outline research. We need to talk about the procedure. So we've done that just now. I'm not going to go through that all over again. And we need to talk about the findings. So the findings are twofold. When objects or words were flashed to the left visual field, participants could not report seeing them. Yeah. Now the conclusion from that is that language isn't in the right hemisphere, but that's not really the finding. You might say that bit later. However, when words or objects were flashed onto the right visual field, participants were able to verbally report seeing them. Again, that's because language is on the left, and we understand that the right visual field is processed in the left side of the brain, and the left visual field is processed in the right side of the brain. If you're mentioning other types of study, so they're not just the verbal ones, then your findings here could be that if a calculation were flashed to the left visual field, so therefore processed by the right side of the brain, then participants could feel for the number that represented the answer. So the right side could perform some simple calculations. You could also say that patients or participants were able to draw the object if it were flashed to the left visual field. And again, that's because it's processed by the right side of the brain, which in turn controls the left side of the body, so therefore they would draw it with their left hand. Lots of crossing over going on here. But yeah, for 6 marks, you don't have to do all of that, but break it down. 3 marks, procedure, and 3 marks findings, possibly with the conclusion from that finding as well. Right, we've got an application question here. We've got Jimmy, who is a split brain patient. We've got him looking at a picture of a key in his right visual field, and he says that he saw a key. Okay, well, let's pick that apart so far. If it's in the right visual field, that is processed in the left hemisphere. Yeah, because the visual fields project contralaterally. They project to the opposite side of the brain. Now, because the left hemisphere is processing it, the left hemisphere is specialized for language, so he is able to report what he's seen. Yeah, because the left can process language. Okay, let's keep going. So that's half the response. When a wrench is presented in the left visual field, he says he didn't see anything. Okay, well, that's because the left visual field is processed by the right hemisphere, the right side of the brain, and the right side of the brain is not specialized for language. Yeah, Broca's area and Wernicke's area are in the left hemisphere. So because the right hemisphere is not specialized for language, Jimmy is unable to report seeing anything. He's not, when he's speaking, when he's responding to questions, he's not conscious, if you like, in his right hemisphere. He's using his left hemisphere. In these split brain patients, it's like they've got 2 brains. So anything on the left, the right brain is dealing with. Anything on the right, the left brain is dealing with. So if the left brain didn't see it, you're not going to talk about it because you don't know it was there. Yeah, the corpus callosum, that thing that's been cut in split brain patients, that is how the information gets between the 2 halves of your brain, typically. Anyway, we're now on to some evaluation. So, we want to explain a strength. I don't want to go off and discuss it too much, I just want to explain. So, a peel kind of structure. So my point might be that one strength of research on split brain patients is that it was done in lab conditions. The researchers, so Sperry and Gazzaniga, were able to control elements such as giving everybody the same images and same words. They were able to control participants' gaze by making them fixate on the cross at the center of the screen. These factors are very important for establishing the internal validity of this study. If we know that patients are only having images presented to the left or right visual field because they're staring at the cross, this means we can establish what the right and left hemispheres do, yeah? So it's internal validity. Okay, next one we want to discuss a limitation. So again, I want to peel kind of structure, I want to explain a limitation, but then I want to discuss it by introducing possibly a counter-argument. So I could start off with actually, and we'll use what we've just talked about in a second, but actually one limitation of split brain research is that it uses artificial tasks. Yeah, so flashing images or words to only one half of the brain is not reflective of how anybody uses their brain in a day-to-day situation. Yeah, we're moving around constantly, we're looking around our eyes, and our objects are entering both visual fields most of the time. We don't sit still and stare at a cross in the middle of a screen. So because of this artificial task, some people might argue that Sperry's research doesn't actually reflect how split brain patients behave in an everyday situation. I'm not saying it doesn't tell us about what the left and the right side of the brain do, but it might not actually mean that much because, people compensate and we use our eyes in a different way to how our eyes are being used in this split brain study. So that might lead us to conclude that it lacks external validity because of this artificial setup. Okay, but the discussion might be that, in fact, even if it is artificial, perhaps that was necessary to get this level of control, and that's where you might counter-argue with that internal validity argument that we just talked about. Okay, don't go too far overboard, it's only 4 marks, but you want to kind of peel structure just with a counter-argument at the end. Okay, we're on to describe and evaluate split brain research. It's only 8 marks, so this is going to be a 3+5 or a 4+4. So, tell me the procedure and the findings of Sperry's research, we've already been through that. And then for 4 or 5 evaluation marks, I would say play it safe, aim for kind of 2 peels. So you could do what we've already talked about, you could do a strength in terms of the control, you could do a limitation in terms of the artificial nature and the lack of ecological validity or mundane realism. Okay, so now we need to flex that up to a 16 marker. Discuss hemispheric lateralisation, refer to evidence. As I said earlier, when you see hemispheric lateralisation, basically you're talking about split brain research. Yeah, you're talking about how the two sides of the brain do different things. The extra command there, refer to evidence, should only make you feel more confident that you need to talk about Sperry's research. So in terms of breaking it down, we've got 6 knowledge marks. We've already been through, we did that earlier, we did the 6 marker outline research, so I'm not going to go through all of that again. I suppose the only edit I would make, just to be on the safe side, is because we're discussing the concept and only referring to evidence, I would probably start by defining hemispheric lateralisation. Yeah, and we did that one earlier. So the idea that the two sides of the brain are specialised for different functions. And then I would go through the procedure and the findings of, say, the Sperry study. So that's your knowledge. Remembering, because these essays are levelled, we need accurate, we need specialist terminology, we need detail. So wherever you can, talking about the hemispheres, talking about the corpus callosum, talking about visual fields, not eyes, talking about specialisation in terms of language on the left. We could mention the term split brain patient, it's a good term to get in there obviously. We could talk about how the brain processes things contralaterally, or at least, in terms of the opposite side. Yeah, so try and get terminology in there. 10 marks for evaluation, and I'd be going for kind of 3 discussion paragraphs or maybe 4 Peel paragraphs. All right, so we've talked through a few ideas already, but just a couple of other things you could mention. It is problematic maybe to generalise from split brain research because they tend to use very small sample sizes or even individuals, so it's more of a case study style of research. These small samples are obviously a problem in terms of population validity, so you could therefore criticise the external validity of this research. You could question how much these findings and how much our understanding of lateralisation really applies to the general population. Yeah. Another issue with that is that because these split brain patients have undergone surgery, their brain physically and functionally is different to a typical brain. And what are we studying? We're studying the brain, so that is a bit of a generalizability problem. Okay, other things you could mention, you could question the reliability or the replicability of some of this research. Later studies, you may be aware of patient JW. I think the reference is Turk et al., if you want to look it up. But patient JW, he was a split brain patient, and he basically developed the ability to, I suppose, pass the split brain task, if you like. So he could talk about things that he'd seen on either the left or the right. And that's probably going to tap into brain plasticity, so you could bring a bit of that in your discussion as well if you wanted to. Because what's probably happened is that JW's Broca's area, yes, it's on the left, so he can talk about stuff that's on the right, but his right hemisphere has developed that language ability as well, probably to compensate for that damage to the corpus callosum. Yeah. So what this tells us is perhaps some of that initial research isn't possibly that reliable because it hasn't been replicated, and or it could tell us that lateralisation is an oversimplification. Because of what we know about plasticity, it's not okay really to just say, oh, the left does this and the right does this, yeah, because the brain can change and compensate. Okay, and linked to this idea of lateralisation being an oversimplification, you could bring in other research which has talked about, for example, individual differences in lateralisation. We understand, for example, that lateralisation changes with age. If you scan the brains or study the brains of older people, you'll see less hemispheric specialisation. You'll see people more able to use both halves of their brain. Now, possibly that's because as we get older, our brains become less capable, and so we have to develop compensation strategies. But the point is, for the purposes of this question, the point is, it's not as simple as saying the left does this and the right does this. Yeah, we understand that there are some patients that can use language in either hemisphere, and we understand that older people in particular don't have this level of lateralisation that we see in younger people. The brain works together more holistically to compensate. Okay, that's probably more ideas than you need for a 16 marker, but you can pick and choose. Okay, so reflection. How did that go for you? What do you need to do next? feed it back into your next steps in your revision. Thanks very much, guys. I hope that was useful for you. Please do drop me a comment or a question. Keep going. Good luck. Bish bash bosh.